Look, Johnny, just because your patient is a dairy farmer doesn't mean their favorite exercise is a calf stretch, okay? Thank you. Oh, so sorry about that. How's it going? My name is Ollie, or Oliver. It's nice to meet you. I see you're here for your neck and shoulder pain physio appointment. You're right on time. Thank you for coming in and filling out your patient chart. Appreciate it. I'll be your physiotherapist for today. I have almost a decade of clinical experience as a physical therapist, and I've worked across the lifespan with children, adults, older adults, across a range of diverse conditions. And I'd be more than happy to help you with your neck and shoulder pain today. Now, I see on your referral here, you mentioned you've been working a lot of late nights recently. Maybe working on the computer for prolonged hours. Maybe in awkward postures as well. Does that sound about right? I see. And can you tell me whereabouts you're currently experiencing your symptoms? Just feel free to point on yourself or on me where you're feeling the strain and soreness. Okay, so more in this neck, up along the base of the neck, as well as that shoulder region on top here. Is that right? Okay. And can you tell me if this is affecting your sleep? You're waking up because of it, or having trouble getting to sleep because of your symptoms? I see. Yes, that is inconvenient. Well, based on what you're telling me so far, it sounds like this pain you're experiencing may have some sort of mechanical cause or a musculoskeletal involvement, essentially involving the muscles and the skeletal system. Yeah, might be harboring some tension and soreness, tautness in those particular areas. But just to be sure, I'd like to ask you a few safety questions. Firstly, are you experiencing any dizziness or otherwise known as drop attacks or fainting episodes? No. Okay. Are you also experiencing any double vision? You're seeing two of the same thing? No double vision. And what about any pins and needles? That pins and needles, funny sensation, or any sensation changes in the neck and shoulder vicinity in general? Okay, that's good. None of those symptoms so far. And lastly, you're not experiencing any difficulty swallowing or difficulty speaking. Okay. Well, this is a positive sign. If we had any of those symptoms, it might be worth exploring further, potentially some neurological or nerve involvement. But because we've cleared those symptoms, I'm very confident that what you're experiencing might be to do with muscles in that area, musculoskeletal cause. So, what I'm proposing today is we'll go through some measurements of your neck, check the strength in your postural muscles, as well as have a feel or palpation in those tender, sore, and tight areas you mentioned before. And I'd also like for you to love us and leave us. That is, I'd like to push towards self-management and independence with managing this pain should it persist or come up again in the future. So I'll leave you with some actionable advice and education to help alleviate your symptoms and pain. Maybe some stretching and exercises to help you get there too. How does that sound? Okay, then let's get to it. Just take a seat where you are. That's good there. I'll just get some gloves on, sanitize my hands. I'll be with you very shortly. Now, how's your day been so far? Just been doing some shopping. Let's see. Having a break from work. It's important. Yeah. I agree. It's good to take time for yourself and take time out of our busy lives to do something for yourself for a change. So, all power to you. I hope you find what you're looking for at the stores. Maybe a suit. Okay, well, let's start then with some neck movements. Can you please start by bringing your chin towards your chest? Chin towards your chest, like so. That's it. Just measure that one. Okay, just getting a nice measurement from the chin to the chest area, seeing how far the distance is there. It's looking good. Just one more time. Okay. Nice. It's looking good so far. And then just the opposite movement now, which we call extension, or tilting your head back like so. Okay, go ahead and do that one for me. Yeah, I'm just going to be measuring behind your head. Good. Just the distance there between your vertebrae, your bony point on your spine, and the base of your skull there. Another way we can do it, just holding that position, just measuring from your chin to your chest, the distance you can get there. Very good. Okay. Next movement, I'll just get you to bring your chin to look over your side, this direction. Chin over to your shoulder, as far as you can, like so. Nice and steady, no rush. Okay. Good, just holding that position for me. Measuring from your tip of your chin to a little bony point on the top of your shoulder. That's it. Good. Alright. And looking forward for me, just bringing your chin towards this side now. Chin looking over your shoulder, chin over your shoulder, like so. Okay, alright. Holding that position, again, just measuring from the tip of your chin to bony prominence on your shoulder. That's looking good. Looking good so far. One side's maybe slightly less movement than the other. This can be quite normal, particularly if you do have some shoulder tension and soreness, but we'll look more into that later. Okay, you're doing well so far. I've got one more movement to do, and that is bringing your ear towards your shoulder in a sideways bend, ear to shoulder, like so. Okay, that's it. Good, just make sure you drop that shoulder, try not to hike it up and cheat. Yeah, keep that one down for me. Good, just like that. Okay, just measuring that one. Ear to shoulder. Oh, nice bit. Roughly 8 centimeters. Okay, and then just repeating that same action, ear to shoulder, sideways bend like so. Just make sure you don't hike up that shoulder. Okay, yeah, just like so. Good. Holding that position for me. Hold. Measuring an ear to the bony point on your shoulder there. It's looking good. Looking good indeed. Okay. Go ahead, take a break there. Shake it off. Shake it out. As Taylor Swift would do. Shake it off. And then we're going to do a quick screen of some of your postural muscles. Now, it's good to check this, as sometimes our neck may not have the strength to meet the demands imposed on it. For example, if you are sitting down for hours upon hours during a workday or study session, then your muscles might not have the strength or endurance capable of doing so. So it's important we have that strength. Let's start with bringing your chin towards your chest. However, I will be resisting you with my hand. I want you to meet my pressure. Simply meet my pressure, but do not beat me. Okay, makes sense. Alright, chin to chest against my pressure now. Here we go. 3, 2, 1. Chin to chest. That's it. Meet my pressure, don't beat me. Meet my pressure, don't beat me. Meet me, don't beat me. Good. And relaxing there. Alright, now tilting back, looking up towards the ceiling, like so. But just against my pressure. Okay. 3, 2, 1. Go. Meet me, don't beat me. Meet me, don't beat me. Meet me, do not beat me. Good. And relax. Okay. Now, chin over your shoulder, like so. Alright, now, 3, 2, 1. Meet me, don't beat me. Meet me, do not beat me. Meet me, don't beat me. Good. Okay. Relaxing there. Just comparing that to your other side now. Again, looking over your shoulder, like so. Okay. 3, 2, 1. Go. Good. Meet me, don't beat me. Meet me, don't beat me. Meet me, don't beat me. Okay, very good. And lastly, bringing your ear towards your shoulder, like so. Just going to apply some pressure against you. Some resistance there. Meet me, don't beat me. Meet me, do not beat me. Meet me, don't beat me. Okay, relaxing. And lastly, the other side there, towards your left, ear to shoulder. Yeah. Okay. Meet me, don't beat me. Meet me, don't beat me. Meet me, don't beat me. Try a little bit harder there. Okay, good job. Alright, you can relax there. Our strength testing is over. I did notice there was a little bit of a discrepancy between your rotation or turning of your head. One side was just that a little bit stronger than the other. But that's okay. That's something we can work on. I'll show you some mobility and strengthening exercises in a moment to address that. But let's now have a feel of some of your tender areas that you mentioned earlier. So, first, along the base of your skull there, just working up parallel as I run my thumbs in those muscles. How does that feel? That spot, that's tender. And compared to this side, roughly equal in soreness. Okay, both tender spots, yeah. What about right into the base of the skull here? Yeah, pretty much where your hairline starts at the back of your head. Yeah, where the hairline starts, is that also very tender? Okay, yeah, I see. Alright, have a little rest there, but I see a lot of muscles tend to move and insert themselves into the base of the skull. It's quite a common area of tenderness and soreness. But let's try now working along that angled muscle there, what we call our upper trapezius. That's it, very common gym muscle to train and develop. But yeah, the top of the shoulder, if I pinch those two muscles there on either side, do you find that is quite tender right here and the same on this side? I see, okay. And digging in there, the same point with my thumbs, that's also quite sore. Okay, see, sorry, I understand that's tender, but it's good for me to know which muscles are involved. So, what I might propose now is I want you feeling a little bit better than when you walked into our clinic. So we'll do some hands-on manual therapy, as we call it, with massage, essentially. So, you're not allergic to any sort of ingredients or oils, nothing that's too sensitive for your nostrils. Okay, good. In that case, we'll get some massage lotion. Just work our way into those sore and tender areas we felt earlier. And this should help alleviate some of those symptoms, as well as improve those neck movements that were a bit rigid and stiff from earlier. Okay. Alright. Yeah, where you are is fine. Just get nice and comfortable, and we'll get some pressure in those muscles. Okay, just starting off on this side, like so. You let me know if the pressure is too little or too much. It's good. Okay, so working along there, getting things warmed up. What we're essentially doing is providing a different stimulus into those sore muscles, helping to try and almost distract the pain receptors with pressure or touch and friction and heat, all things that can help interrupt the pain pathways leading to the brain. Something called the pain gate theory, but I won't bore you with the details. But pain is a complex phenomenon, so it's often multifactorial, and everyone's experience is unique. So, just something to consider. Okay, just get in there with a bit more pressure on this side. So, there we go. Just sweeping up and down along that muscle. How's that pressure feeling? Good. This side. Both sides. Yeah. And we'll just get in there into those upper traps, those mirror muscles we spoke about, with a bit of pressure from my elbow here. Just moving that one. That pressure's okay. Good. And just on the other side there, same thing with the elbow coming in. You're doing great. That's good. Okay. Alright, just on the top of the shoulders again, sweeping up there. Good. Just a bit of chopping there, or tappement, as we call it, in that shoulder. Tap, tap, tap. Yeah, a lot of people say this one can feel relaxing. Quite rhythmic and soothing. oil fully rubbed into the muscles there. There we are. Very good. Go ahead and try some of those movements now. We might notice some changes straight off the bat, actually. So let's start with those problem movements from earlier. Bring your chin across to your side there, like so. Okay, just measuring that one. Comes in at roughly 2 centimeters improvement. But how does it feel, more importantly? Feels a bit looser. Okay, yeah. Less pain and feels freer. That's exactly what we want, yeah. So let's try the other side now, looking your chin over your shoulder like so. Good. Let's measure that one. Get this one. Not quite as much improvement, but still about 1.5 or half an inch, 1.5 centimeters. Those were your main sort of stiff movements that we found earlier. So it's encouraging to see, and of course feels a bit better, a bit freer in general. But like I said earlier, it'd be good to show you a few tips and a few stretches and exercises. The first thing is with a hand towel, something you can keep with you at your work desk or take with you to your study area. But essentially, with our nice firm towel, something with a bit of thickness to it. Any hand towel should do, like so. Just want to roll that one up a long ways, like so. And then what we can do is place this behind your neck, almost like so, nice and snug. Nice strong grip on the ends. I want you to rotate your head to your left, my right. As you do so, you're going to pull with your hand towards that same direction to apply a bit of a stretch. You're almost like you're helping that rotation movement. I'll show you what I mean. So, turning and pulling with this hand. Good. And back to the middle. You can repeat that on the other side. Turning your neck, pulling with this hand. Like so. Applying as much pressure that you can tolerate, essentially. So, those are our towel pulls exercise to help with your mobility in the neck rotation. I'd also recommend some chin tucking. Your head is quite heavy. Everyone's is. It can weigh between 4.5 kilograms to 5.5 kilograms, or roughly 10 to 12 pounds. Quite a weight. So it's important for us to have strong neck muscles to be able to sustain these upright postures, such as standing and sitting. So what I would recommend is doing those same movements I showed you earlier, chin to chest, tilting back up to the ceiling, looking over your shoulder as well as bringing your ear to your shoulder as simple movements you can do to help get a bit of blood flow or circulation to those muscles that you're having trouble with. It's a lot of nutrients in blood, but there's also benefit in moving those joints in your neck. Movement is medicine. So, in terms of strengthening, I think you would benefit from a chin tuck exercise for strength. Essentially, we're imagining our head is a filing cabinet drawer, and you're drawing your chin directly back, like so. Not up, not down, but directly back, making sure your chin is still horizontal as you do so. I'll show you what I mean from the side. Might help, like so. So we call that a chin tuck or turkey tuck, but whatever helps you remember is sufficient. And I don't want to overload you, but there's one more exercise I think you'd benefit from, and it is a stretch whereby you turn your head 45 degrees and bringing your hand over your head like so. We're aiming to bring our nostril or chin towards your armpit region to stretch out that really tender and sore muscle that we were pressing on earlier. So, head 45 degrees, hand on top to assist with the stretch. Shoulder relaxed, pulling towards that neck and shoulder, armpit region. Enjoying the stretch and the side of the neck here. And you'll feel it in there as you do that. Just make sure that other side doesn't hike up. Try to relax. Bring that shoulder down. Feel free to hold that stretch for roughly 15 to 30 seconds as a starting point, and on both sides. I'll write all these down in a home exercise program for you and email it to you or give it to your best contact at the end of our appointment. But the last thing I wanted to talk to you about was movement variation. Really important, particularly if you're spending many hours at a workstation or study desk, to introduce movement variation into your activity. What I mean by that is every 10 to 20 minutes, just take a break, literally move your neck and shoulders left, right, up, down, shrugging, circles, even going for a short walk down the hallway, for example. Anything that will help break up the pattern that you have set. Something to change your posture and introduce some variety. We like to say your next posture is your best posture. Your next posture is your best posture. Keep that in mind at your next session. But that concludes our physio appointment today. While I type up your exercise program here, did you have any questions at all or concerns? Okay. Everything makes sense so far? Yeah. That's good. I'm glad. It brings me satisfaction too. I like the teaching aspect of my job, so yeah, it's very satisfying. Alright, I'm just adding those exercises into your home program. I'd recommend doing these non-consecutive days, 2 to 3 times a week if you can. For example, Monday, Wednesday, Friday, Tuesday, Thursday, that kind of thing. Non-consecutive days. Yeah. And pretty much until your symptoms start to subside, which should hopefully be very soon. These things can take a bit of time, but if you follow these exercises and my advice on movement variation, I think you might find some changes in your symptoms. Okay, just making sure that's all on there, as well as the fact sheet on what we spoke about. And all the information's on this fact sheet. All the exercises are on there. You don't have to remember how often or how long to hold it for, like we mentioned earlier. So, can I just grab your best contact? Yeah, email's fine, or mobile number. Yeah. Okay, let's go with that. I see. Is that your surname? Yeah. It's very uncommon. I haven't seen someone with that last name before, but alright. And is that at gmail.com? Okay. Yahoo. You don't see that too often these days at yahoo.com. Okay. And send. Well, you should get that pretty much instantly, but that concludes our session today. It's been a pleasure working with you today. I hope you are feeling a lot better than when you first came in. And like I said, this is something that should improve relatively quickly if we make a few tweaks to our lifestyle and incorporate some of these exercises to help strengthen and improve your neck mobility. So, take care, and I hope you have a wonderful rest of your week. Thanks again for coming in. Okay, bye for now. Thank you to my awesome patrons, Andres Erland Vasquez, James, Astor, Scott Walker, Kirsten, Josh, Patrick, Gabriel C., Will Hume, Emma, Here's Mikey, Chad Moore,